Well, thanks everyone for joining us today. This is a webinar from the 3IE member webinar series. It's called From Ensuring Access to Ensuring Success, the Journey of the National Social Protection Agency, Republic of Maldives. And it's looking like a really interesting So just before we get started, I wanted to just say a couple of words about the series and about our presenters. So this member webinar series, it's really an ongoing series that we have to explore issues and innovations related to rigorous impact evaluation, especially impact evaluation, and evidence for development decision making. The presentations are by members mostly, and then with some participation from 3IE staff and also from external experts on these topics. And the reason that the series started was for a few reasons. One was really to meet the demand or the interest that we're hearing from members in learning about each other's work. And it's, not just through the live webinar, but also, we're recording this and we'll post it on our website and YouTube channel so people in other time zones or for whatever reason weren't able to join today can benefit. And it's also, to help us engage with lots of different staff from our member agencies. We tend to see, the same 2 or 3 people who come to our members conference, for example, or those kinds of things. So this is just a nicer way for us to connect with large agencies. So our speakers today, we have the first presentation actually is the second one here, Ritwik Sarkar, who is a research associate based in 3IE's New Delhi office. Ritwik is responsible for assisting the head of evaluation at 3IE in coordinating grant windows, preparing grant proposals, organizing steering group meetings, assisting with in-house research, and managing external relationships. He has 12 years of experience in the field of research and development. He started his career at Seva Mandir, which is an NGO in India. He worked in remote villages of the Udaipur district in the Indian state of Rajasthan, where he monitored a non-formal school education program and libraries, trained school teachers in pedagogy and content, and supervised drought relief activities in select villages. He has previously worked for the Institute for Financial Management and Research, also JPAL, World Bank India, and in Indonesia. Ritwik has a master's degree in social policy from the London School of Economics. Our presenter from the National Social Protection Agency of Maldives is Ismail Azzam Wajeeh. He's been working with NSPA as the project coordinator for Pension and Social Protection Administration Project, financed by the World Bank from 2012 until 2014, and he's been the technical advisor since 2015. During this period of time, he's played an important role in providing technical support to the organization in developing the recently gazetted policies of social protection programs, as well as the organizational restructuring and reform of social protection program implementation mechanisms. He holds a bachelor's degree in business management and a master's degree in sociology and anthropology. He's also the general manager of the National Healthcare Financing Arm of the Government of Maldives. And just to introduce myself as well, I'm Jen Ludwig. I'm a senior program manager. I work in 3IE's Washington, D.C. office. I'm mostly involved with our institutional advancement work, which includes fundraising and member engagement activities, including our as well as this webinar series. And I'm also involved in some of our professional services work. So before we get into Ritwik's presentation, just a couple of notes for people who are new to this platform. You'll notice that all of the participants are muted, and that's because we found it's more comfortable for people to participate in the Q&A through the chat than rather just speaking, to a group like this. So if you look into the bottom, we have a chat box, and you can type in anytime throughout the presentations. If you have questions or comments, please feel free to just type them into the chat box, and we will have some time for Q&A at the end of both presentations. And so we'll get to those kind of, in due course. So I think right now, that's about it for the introduction, and we can just change to Ritwik. So hang on one second, and thank you for your patience with some of the technical issues. Okay.
Great. So can you see the screen?
Yes.
Back to, yeah. Thank you, Jen, for the introduction, and good morning, good afternoon, good evening. Thanks to all the members for attending this webinar represented across different continents in different time zones. As alluded by Jen, I'll attempt to give a brief background and history of the collaboration between NSPA Maldives and 3i and how it came into fruition before I hand over the presentation to Ismail Azzam from NSPA, who will in turn provide a more detailed account of Maldives, especially NSPA's journey towards an evidence-based policymaking for one of its most important social protection programs. And I sincerely hope that through this webinar, we will all learn important lessons on how to incorporate a culture of evidence-based policymaking while implementing or scaling up development programs. The collaboration, if you can change the slide, Jen, thank you. The collaboration with NSPA Maldives was executed through a modality known as policy window. As you know, 3i primarily funds policy-relevant rigorous impact evaluations through different grant windows. So let me explain briefly what a policy window grant is. It is a demand-driven grant window that supports evaluation of programs and policies identified by policy organizations as important. And this window sets itself apart from other windows, since in other funding windows that 3i operates, the broad themes that define the objective are mostly donor-driven. Whereas in policy window, the demand for evidence regarding effectiveness of a program or policy comes directly from the policy-making organization. For instance, in this case, the National Social Protection Agency. One important point to note, however, is that only 3i member organizations from southern countries are eligible to apply for policy window grants. Jen, the next slide on NSPA and 3i background. Now, just to give you a brief background to this collaboration between NSPA and 3i, the NSPA Maldives first approached our then Deputy Executive Director of Evaluation Unit in February 2013 in a city called Bangalore at a World Bank meeting. Thereafter, there was a continuous discussion on membership and developing a program on impact evaluations of some of its programs being implemented. After back and forth, finally, a formal memorandum of understanding for membership was signed in April 2015. The potential areas of conducting impact evaluation in the areas of health, education, social protection, and local governance were explored mutually. NSPA had a few rounds of internal discussions as well, and broadly speaking, they identified 4 programs that they potentially wanted to be evaluated. And these 4 programs were Single Parent Allowance Program, Disability Allowance Program, Food Subsidy Program, Destitute Assistance Program. In the next presentation, Azzam would provide some details of these programs. Jen, if you can change to the next slide on choosing the right team. Once we jointly identified the potential programs for evaluation, the next step was to issue a request for qualification for selection of a research team to conduct the impact evaluation in 2 phases. Now, the first phase was the proposal preparation phase, whereby the selected research team was expected to engage and interact with the National Social Protection Agency to identify the priority program for impact evaluation and also work on the evaluation questions. The second phase would be the actual implementation of the impact evaluation. So after all these deliberations, the request for qualification, which was a worldwide bid, was launched by 3I in January 2016 and open to research organizations and consortiums all over the world. Once the deadline of submission of the RFQ ended, NSPA and 3I worked together to select the team with the right mix of skills. And after a rigorous selection process, we found that the London School of Hygiene and Tropical Medicine was the right research team for awarding the proposal preparation grant. The beginning of this work was an inception visit, which was made by the research team of LSHTM to the Maldives around May 2016, if I'm not wrong, to meet with the National Social Protection Agency team. And they had a very elaborate list of activities which they followed. They conducted an impact evaluation workshop, and the workshop was organized for the National Social Protection Agency staff and other development stakeholders in the field of social protection in Maldives, which included UNICEF, Ministry of Law and Gender. This workshop was led by LSHTM researchers and was conducted to help stakeholders understand why impact evaluations are important and useful, what is needed to undertake these, and how to apprise and understand study findings and put them to use. Jen, if you can go to the next slide. After this inception visit was organized, there was a consultative meeting held between NSPA and the research team to identify the program that was suitable for evaluation using an impact evaluation design. The research team, together with NSPA, identified the disability allowance as the program most suitable for an impact evaluation. And the main reasons for choosing the disability allowance program was that it was the largest cash transfer program run by NSPA, currently including more than 6,800 participants. Additionally, the Disability Allowance Program is a well-established program which was operational since 2010, more than 7 years. And of course, the most important reason was that the program was not being evaluated, and so there is limited evidence on whether they are achieving their stated objectives and what improvements, if any, are needed to enhance the effectiveness and performance of the program. Once the program for evaluation was identified, the LSHTM team worked with NSPA to identify the primary evaluation questions for the impact evaluation. And I'm happy to note that the impact evaluation, the second phase, has just commenced as of February 2007 and is expected to run for approximately 2.5 years. I would now like to invite Ismail Azzam from NSPA Maldives to share NSPA's experience of implementation of its program, as well as their paradigm shift to measuring the impact and effectiveness of the program they implement, with a larger focus on evidence-based decision making with regard to their policy process. Over to you, Azzam.
Thank you, Ritwik, for your presentation. And please, anyone, again, who has questions or comments, please just type that into the chat box. And I'm going to try to, hopefully the technical part of the platform will go a little smoother. And Ismail, I'm going to transfer it over to you. Let me know if we run into any challenges with the slides.
Thank you, Jen and Ritwik. I hope everyone can see my slides now.
Yep, we're all set. Thank you.
Yeah. Good morning from the Maldives, and today's webinar we're going to focus on how the National Social Protection Agency of Maldives has moved from assuring access to ensuring success via evidence-based systems. So to begin with, let me just highlight few areas that we're going to discuss today. Just to let or give an insight to the country, I'm just going to give a brief introduction of Maldives first, and then after that I'll be highlighting what the National Social Protection Agency of Maldives is, and then followed by the social protection system in Maldives, and most importantly, we'll be highlighting the shift in paradigm from access to success in Maldives. And in the initial introduction, as well as Ritwik has provided insight for you audience, the engagement with 3IE and the works that we are undertaking with 3IE are going to be highlighted as well. And some challenges and how these challenges were encountered will be discussed as well. So I hope it's going to be an interesting presentation to you. To begin with, Maldives is a very small country, and it's a low-lying nation with about 400,000 people living in it. And as you can see from the map also, it's geographically dispersed into about 21 atolls. And these are very small little atolls with about 1,190 islands total. And of these 1,190, only about 200 are inhabited. So you can imagine the geographical challenge that we have in transport and communication is considerably large. When we go into the economy, it is mostly based on tourism, and all tiers of hotels and guest houses are spread across Maldives and can be located in all parts of the country. When you see the population, as they are dispersed into such small little islands, we have a huge challenge when it comes to providing basic necessities and services to these islands, especially when some of them are, most of them are less than 1,500 in population. As you can see from the detailed map, one of these atolls are not necessarily fully land. The green color drops or small little specks are the only pieces of land that are on these atolls. The rest are different levels of shallowness of water. So we have very limited space compared to most countries in the region. So let me go into some detail about the National Social Protection Agency now. It was formed in 2008. However, the legally re-establishment of the agency came in 2011 under the National Social Health Insurance Act. And it aims to provide financial as well as in-kind assistance to the vulnerable and the poor, creating a safety net for the people of Maldives as well as the vulnerable population of Maldives as well as their children is the main goal of NSPA. Currently, we have about 6 major programs that are running, and this has been going on since the inception of the organization in 2008. If you go into the coverage and the amount that we spend on social protection through the National Social Protection Agency, about 8% of the government budget is allocated roughly every year for social protection via the National Social Protection Agency, and this is about 3.8% of the GDP of Maldives. And if you in Maldivian rupiah, this is about 2 billion Maldivian rupiah annually. So it's not a small operation, but the impact of the whole social protection service is not purely just from the National Social Protection Agency, but from a couple of combination of agencies. So this is what I'm going to highlight next. 3 main proponents of social protection in Maldives. So when we talk about social protection in Maldives, the key agencies that undertake activities that contribute towards the welfare as well as the social protection realm are the Ministry of Gender and Family, who is solely responsible for the social service aspect of it. And the ministry is present both in the capital as well as in the outer islands as well. So the closest point of contacts within the islands and the atolls will be the Ministry of Gender and Family for the social protection mechanism. When we go into the social assistance aspect of it, the National Social Protection Agency, as highlighted to you earlier by Mr. Ritwik as well, is the main proponent of providing financial assistance as well as providing in-kind assistance to the general public. And when it comes to the pensions program, the retirement as well as the old age pension is administered through the Maldives Pension Administration Office. And the combination of all these three tenets of social protection actually provides a well-rounded social safety nets system as well as a comprehensive social protection system for the Maldivian population. Going on to the key programs at NSPA, the financial assistance program for the single parents, the financial assistance program for the foster parents, and the disability allowance are amongst the key programs that have been undertaken by the agency since its inception. The food subsidy program, medical welfare program, and the universal healthcare financing program are all key programs that have huge populations or huge beneficiary coverage within the country as well. And when we look at the new programs, we do have new programs that are in the pipeline that are going to be implemented, including the destitute allowance as well as assistance for mental health patients. When we come and look into the growth of the agency from 2008 until 2016 and on to 2017, we see a huge paradigm shift from the focus on excess to the focus on achieving success. So basically, in its earlier days, the focus was mostly on inclusion. Previously, the agency's main aim was to ensure that a majority of the population who were vulnerable and facing challenges due to the lack of access to social protection services were included in the system as much as possible. So since then, the focus has slowly, once the organization has achieved the target of inclusiveness, it has shifted its focus on targeting beneficiaries and ensuring that the right beneficiaries are getting the right type of assistance. Since we have a couple of programs and there are other services within the nation that complement the programs that we have, the focus then shifted towards ensuring that the target population, the target beneficiaries were able to access all the different types of services that were specifically designed for them. So this slowly brought the focus on ensuring that the right person was getting the right benefit. Moving on, the National Social Protection Agency saw that gauging the success of the cash transfer programs as well as all in-kind assistance programs were very important to ensure that the money that was spent on the schemes were being utilized at a proper mechanism and being contributing towards the welfare of the vulnerable population. So NSPA started ensuring that the population that was being provided with the assistance, the vulnerable population, were actually getting this assistance on a timely basis, and whether they were getting this assistance through the caretakers, through the agencies that were responsible for passing down these assistance to them, whether these were done on a timely basis. So NSPA has slowly started to expand its operations into actively monitoring the programs that were being conducted by the agency, and hence the monitoring division was established and quarterly monitoring into the atolls were started, and this is a successful program that is going on even now. However, after a couple of years of implementing the monitoring programs, the desire to assess the pure impact of the different programs that were being conducted by the agency was highlighted by the agency as well. And NSPA started to engage with the aid organizers, including World Bank and WHO and UNICEF and ADB and such organizations, to find out whether there were possibilities of conducting or engaging in a way that we can comprehensively assess the impact of the programs that are being conducted by the NSPA. And as Mr. Ritwik detailed out to you, the engagement with 3IE came as recommended by many stakeholders within the aid organizations as well. And with this interaction with 3IE, NSPA has learned as well as exposed ourselves into the benefits as well as the utility of conducting impact evaluations and utilizing the information that we gather, the results that we have, the recommendations that we will have in the future on the impact evaluations, to utilize them in the development of new programs, in the improvement of existing programs, and ultimately to have action come out of these impact evaluations that are going to be conducted on the programs in NSPA. As discussed earlier, the engagement with 3IE has not just only been focused on conducting an impact evaluation or the piloting of the exposure seminars and the workshops that are on impact evaluation, but rather it has been an eye-opener for the whole country also. So as Ritwik highlighted earlier, the 3IE team was proactive in visiting Maldives and conducting a lot of sessions for many of the stakeholders to simply, first to simply aware them on what impact evaluation was and how these could actively be utilized to ensure that the programs at different organizations are being conducted in line with the goals and the objectives that were being highlighted on the design of those programs. So with this successful interaction, I think that expedited our journey towards becoming a member as well, and even the AG office gave clearance for us to be a member of 3IE, and Maldives has actively become a country who is seeking impact evaluation as a source of empowerment as well as a source of evidence-based decision-making tool to be utilized in that process as well. So apart from the assistance that 3IE has provided to the NSPA locally, it has also helped us to visit other countries, to visit forums, to visit conclaves where impact evaluation has, or the effects and the results of impact evaluations have been discussed. And this exposure has also created the urge for NSPA to be the proponent of impact evaluation in Maldives as well. And as Ritwik highlighted, we are undertaking the first impact evaluation of a social protection program in Maldives, and it has started in 2016, and we hope to see it completed within about 2 years and hopefully done in 2018. When we come into the challenges that were encountered, as you can imagine, Maldives being a small country and with very limited possibilities of traveling and communicating with all the islands of the country, it has a limitation in exposure to large monitoring and impact evaluation mechanisms. So as you can imagine, the concept was novel when it first was discussed in Maldives. in the initial 3IE stakeholder awareness campaigns. So basically, impact evaluation was not a concept that was understood by many of the stakeholders, though monitoring was done by many stakeholders on many of the programs. The comprehensive impact evaluation aspect was somewhat new to most of these stakeholders. However, the interesting aspect of it was that after the exposure stakeholder exposure workshops were conducted, we were happy to see that many of the stakeholders were proactive in seeking assistance through us, as well as exploring options for themselves to also engage in impact evaluation programs. And I think the program that we have chosen, the disability program, has one of the largest stakeholder bases on the programs that we have at NSPA, and most of these stakeholders have now actively communicated with NSPA, saying that they are in fact going to utilize the results of the impact evaluation in their own design, as well as in their own supplementary programs that they're going to design for the disability allowance that we have at NSPA. So this is good news for us, and I think it is a possibility of bringing all the stakeholders together and working towards a consolidated goal as well. When we came onto the practical implementation of the impact evaluation, we did see that the local knowledge on the subject was also limited. So there were no readily available local experts who could actually help us on engaging with the impact evaluation teams also. So there were a few challenges in the early stages. However, with the directive from 3IE and the assistance of LSHTM in actively engaging local experts on the practical implementation of the first ever impact evaluation that we are going to hold, I think is going to be successful in the future, especially building the capacity within the Maldivian community on the tools and the methodologies that are being utilized for impact evaluation. When we come into the major challenge that we have, especially with regard to even program design and practical implementation of programs, is the geographical dispersion and the diversity that we have due to the geographic dispersion existing in the country. So as you can imagine, the distance from each island, the distance from the capital to the respective islands, and the location of the atoll is all different for every single island of the Maldives. And due to this, there is a huge diversity that is created, which are unique for each and every island of Maldives per se. So this was something that we saw as a challenge that we had in designing the impact evaluation, as well as understanding the full range of impact. So one of the activities that we had conducted to minimize this challenge was to acclimatize the experts who were designing the impact evaluation, as well as bringing them to different islands, to different localities, and expose them to the diversity that was existent within these islands that need to be addressed in the impact evaluation as well. So I'm happy to say that the initial impact evaluation team, as well as the training teams, have been acclimatized and have visited these islands and have been properly exposed to the difficulties that are there even within Maldives to cater for all the requirements that are there in these unique different islands that we have in Maldives as well. So basically that covers my presentation into the shift from purely ascertaining accessibility to become an organization that has adopted the need for evidence-based decision making through tools like comprehensive impact evaluations in the future. So I'll hand over to Jen and I'm open for any future questions from the audience as well.
Thanks, Azam, so much. It was a really interesting presentation. And we don't yet have any questions from the participants, but I had a couple, I guess, to maybe start the conversation. We have a few more minutes in the session today. So I guess one of them is if could you talk a little bit more about who the stakeholders are? Are you talking about sort of beneficiaries of the program or program staff? And where the concerns or the challenge is kind of getting them on board, was it the same, based on kind of broad kinds of challenges, or were there any kind of distinctions between different groups? And then I guess related to that, and this has to do with just that I work with 3IE, but I haven't been involved with a policy window. I think it's really exciting and interesting in how much thought and inclusivity went into stakeholder engagement in the beginning, and I'm curious about what are the other points, either during the during the study or in terms of the dissemination and sharing results after. How do you continue communicating with the stakeholders or with the broader audience? And maybe Ritwik can comment on that as well.
Thank you, Jen. I think it's a good question, especially on the diversity of the stakeholders that we have. Like you correctly mentioned, we had few different types of major stakeholders that we had a couple of differences in or different challenges, especially in the dealing with them as well. So to begin with, one of the key stakeholders that we have are the island as well as the atoll councils and the administrative function that are present in every single island of Maldives. So these officers are the first contact point or the focal points for the programs that are being implemented by the government agencies in Maldives. So the concept of going down and assessing the comprehensive aspects of how a program is being utilized by the beneficiaries, how this program is impacting them as well as their families, their whole island, the whole atoll, was something that was quite well received by the island as well as the atoll officers in Maldives. So though they never had received recommendations or results of the of such a impact evaluation in the past, they were quite excited to actually utilize these impact evaluations in the future as well. So this was one of the island communities, or these are the island communities that usually engage with the beneficiaries on a daily basis. And I think for them it was very much of the welfare of the beneficiaries on a on a personal level, on an individual level, that were being discussed, and that were being the results were expected on that ground. However, when it came to the institutional stakeholders such as Ministry of Gender and Family, Ministry of Economic Development, and Ministry of Education, and Ministry of Health, we had in our engagement with them prior to the just in the exposure workshops for impact evaluations, even they saw it as a opportunity as well. They saw it as a mechanism for them to learn of how productive in impact evaluations result could be utilized in the future, and also for them to learn on how the different aspects of a program can actually have impacts in some areas that we may that the stakeholders may not have really thought about in the past. So for an example, the financial impact of the cash transfer programs were very much purely thought of as an individual or at least something that goes directly only for the families, only for the local communities that they were living in. However, it was important to note that in the exposure exercises, even the Ministry of Finance as well as the Ministry of Economic Development saw it as a potential area to really understand how government finances that were going into social protection were probably impacting the economic side of, or the productivity of an island, not necessarily just the beneficiaries, but also the whole island, the island as a whole was actually being impacted by these programs that are being conducted across Maldives. So as you mentioned, there were a lot of perspectives from many of the stakeholders, and we did try to engage as much as possible all stakeholders that were there in most of our programs, including government, including non-government organizations, including the private sector, as well as the island and atoll level beneficiaries, as well as different organizations that were located within these local communities as well. I hope that gives some insight to your question, Jem.
Yeah, absolutely. Thank you. I guess Ritwik, did you want to add anything to that? Maybe
That
just from 3E's perspective, how what was kind of maybe unique in terms of working with NSPA,
I think
from your experience.
that's a very relevant question, and my 2 years or 2.5 years of experience in 3I, we have engaged intensively with NSPA and Azzam for that matter. But one of the few challenges that that was mentioned by Azzam rang a bell with me as well, because the experience that we have seen normally is that researchers normally have their own agenda, but then 3I believes in policy relevant studies, and quite often there is a unwillingness on the part of researchers to engage with stakeholders, since they don't see it as a part of their job. Their job is to do studies. So even when we do insist on engaging very intensively to formulate the research questions so that it's relevant for the policy organizations, they when they I mean when they realize that and they share the study findings, maybe it's too late. So it's a challenge on how to build ownership of the study and findings. And from the implementing agency side, sometimes it's difficult if a champion of impact evaluation suddenly leaves and goes to another organization. For example, if we were to engage with NSPA, and to be honest, if Azzam was not there, who is himself a champion of impact evaluation, it's a challenge if Azzam suddenly moved out and there was a vacuum. So we had to start all over again. So I see like these are the principal challenges in my experience that we have faced so far in engaging with stakeholders.
Sure. Yeah, that makes sense, and that resonates, I think, with probably the experience of lots of people at 3IE and NSPA and others. It looks like we haven't had questions from the audience at this point. I think it's still early for most people, um, and we're kind of running at a time. I think we can close up unless there's anything, Azam or Ritwik, that you wanted to close with. Okay, I guess we covered it, but thank you both so much for sharing your presentations, and thank you to everybody else for joining. I will be sending a PDF version of the slides to you and to others who registered, and we hope to see you either virtually through the webinar series or at some of our upcoming events over the course of the year. So thank you very much and have a great day.
Thank you, Jen.
Thank you all for listening to us. Yeah, thank you.
Yeah, thank you all the participants.